Welcome back to the Doctor Is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon here in beautiful Monterey, California. Thank you very much for being here. Today, in this segment, I'd like to discuss and answer and address one of the most frequently asked questions I hear in my office, and sometimes when people are considering a consultation. And that question is it possible that I can have an isolated neck lift? Can I have only a neck and jowl lift, or do I have to have a facelift as well? This is one of my favorite questions because I think that there are other plastic surgeons that disagree with me, and that's okay. In my practice, rest assured, I can tell you with some assurance, I can guarantee you that in my practice, in my office, you can get a natural neck lift or a neck and jowl lift, and you do not have to have a facelift. I'd like to be clear about that. So let me back up for a moment and talk more about what a natural neck lift is. I'm going to talk briefly about what a facelift is, although no one really knows what a facelift is. It can be so many different things. And then we're going to talk about the differences and why in my practice you can have an isolated neck lift or a neck and jowl lift and you don't have to have a facelift. First of all, the natural neck lift is a system of analysis. It's not one operation or one treatment. It's a system of analysis looking at your anatomy, your medical history, looking at your expectations and your desires, and then going through a custom design approach system, developing a plan for you to leave a natural appearing result. Once again, it's a system of analysis. That's the natural neck lift. And as I mentioned, the natural neck lift can be accompanied by a jowl lift. Neck and jowl lift is something I do more commonly, I think, than an isolated neck lift. But if you'd like to have just a neck lift, that's what you can have. Now, a facelift, of course, elevates the soft tissues above the mouth, or as we say, plastic surgeons say, cranial to the mouth. In other words, the neck and jowls we consider to be the lower third of the face. The cheeks, that's the mid-face going up to the lower lids. And then, of course, the upper third of the face, that's the upper eyelids, the brows, and the forehead and the hairline. So typically, when we discuss facial rejuvenation surgically, we look at the face in thirds. The upper third of the face is the hairline, the forehead, the eyebrows, and the upper lids. The mid-face, that's the lower lid area, and the cheeks, nasolabial folds, I would say down to the mouth or the lips. The lower third of the face, the neck and jowls. So, why is it that some plastic surgeons, I've heard, I understand, tell their patients that they cannot have an isolated neck and jowl lift, they have to have a facelift along with it? Well, it all depends, in my practice, it all depends on what the patient wants. If a patient comes in and says to me they don't want to change their face, but they would like their neck firmed up and they want a cleaner, crisper, firmer, better defined chin, jaw, and neckline, well, the incisions for that operation to me, in my practice, are different than if someone comes in and says that they feel their cheeks are sagging, their nasolabial folds are heavy, the corners of their mouth look kind of droopy, their malar area, the so-called arches, high arches of the face, they seem to be sagging. So those incisions are slightly different. So if someone wants a facelift, again, that's a custom designed approach. No one really knows what a complete facelift is anymore. It could include the eyes, it could include the lateral brow elevation. Sometimes it includes the forehead. It can include the cheeks and nasolabial folds and neck and jowls. Sometimes, to some people, a complete facelift includes the nose. So what I like to do, of course, and what I advocate in my office is a custom designed approach. We offer what I call a component facial rejuvenation. We lift and fill. I believe in volumetric restoration. You've heard me talk about the triangle of beauty or triangle of facial rejuvenation. The skin, volume changes, and soft tissue position and repositioning. Those are the three parts of the triangle of beauty, the triangle of facial rejuvenation. So we can use all three of those components to perform facial rejuvenation. Now, if someone comes into my office and they say they want a complete facelift, well, my advice to that person is, a man or a woman, that we look in a mirror together. We look at photographs of them that I can take together. Let's look at photographs from decades prior, and let's look at the vector computer imager. Take your image and process it through the vector computer imager, and then we sit down, and instead of just calling it a complete facelift, let's discuss more specifically, what is it that you want to change? Do you want to change your forehead? Do you want to change your eyebrow, your upper and lower eyelids, your cheeks, your malar areas? Do you feel like you've lost your high cheekbones? Do you feel like your nasolabial folds are too heavy? What about your neck and jowls? So we can do component analysis, and again, leading to a custom designed approach for you, because everyone ages differently, everyone's faces differently, not everyone wants the same thing. So in my practice, you can have your eyes done by themselves. You can have your brows elevated if you want by themselves, cheek elevation, neck and jowl only, etc. So the incisions, however, are different. So for example, if someone wants just their cheeks elevated, lower cheeks elevated, usually I carry the incision up from the earlobe in front of the ear or right along the cartilage up into the so-called sideburn or temporal tuft. For women, we call it the temporal tuft of hair, and in men, it's the sideburn. I carry that incision up into that area and sometimes up into the temple area. That way, we can elevate the tissue safely, get proper exposure, redrape the skin, elevate the skin. What I like to do is more reposition the skin, elevation and lifting rather than simply to remove it. I find that if too much skin is removed, if there's too much pulling, that tends to give a tight, unnatural sort of done look, whereas we want volumetric restoration. We want the face to project. A projecting full face is a youthful face. So, in general, the facelift incisions, cheek lift incisions, tend to go higher up right at that edge where the ear meets the cheek, up into the temporal tuft of hair, the sideburn, oftentimes into the temple. And then, if we're also going to do the neck and jowls, the incision goes under and around the earlobes to the crease in the back of the ear, across that mastoid bone in back of the ear, and then into that hairline, the mastoid hairline. Oftentimes the neck and jowl lift is accompanied by a short curvilinear incision or curved incision in the submental crease. I find that about 90% of Americans, or 80% of Americans who come into my office already have a scar under their chin. It's because their little brother pushed them down the stairs, or they fell from their bike or tripped on the curb, etc. So they already have a scar there. So those incisions, we can use some of them, we can extend them, sometimes we shorten them to gain access to the areas where we want to affect, where we want to lift, where we want to reposition, where we want to elevate. So let's keep in mind, as I said, volumetric restoration. Oftentimes I'll recommend addressing the volume portion of the triangle. So for example, if we're going to talk about the triangle of facial rejuvenation or the triangle of beauty, again, there's the skin, that's texture, that's chemical peels and laser and skincare and resurfacing. Then there's volume changes. As you know, as we mature, we tend to lose fat in the face and in the hands, and we gain that fat in the trunk. It's an unfunny practical joke. And then there's the soft tissue position. Has it descended? Does it need to be repositioned, etc.? And of course, that triangle rests upon a foundation. That's the craniofacial foundation. That's the skeleton, the actual foundation of the soft tissues of the face. Sometimes we bring the chin forward. Sometimes we will augment the cheekbones. You've all heard of the expression high cheekbones of a model. So that's a desirable characteristic. We want to have a volumetric restoration. We want to lift and fill, not just pull and remove the extra skin. So, back to the question, can I have a neck lift without having a facelift? Rest assured you can in my practice. What's that like? First of all, most neck lifts, if we're going to do a submental platysmoplasty or address the tissues underneath the chin, in this anterior part of the neck, they're going to get that a curvilinear incision or curved incision in the submental crease. And it's been my experience in over 20 years of plastic surgery, hardly anyone ever is concerned about that scar. It tends to fade very well. The scar is seen only in what we call the worm's eye view. In other words, if someone is looking from your feet or from the ground up, sometimes they can see it. But face on or from the side, in general, that submental incision is not visible. But through that incision, I can sculpt the fat. I can address the lax muscles, those bands that some people get. Sometimes people come in and they say they want a waddlectomy or they want the turkey neck correction procedure. Most of that is done through a submental incision. So I can gain access, I can sculpt the fat, remove some fat, I can address that loose muscle, I can tighten it up. Sometimes I divide those bands. And then from those periauricular or incisions around the ears, starting at approximately the tragus is this little piece of cartilage here. Starting there, I can go down to the earlobe, under and around the earlobe, across that mastoid, and into the hairline. Through those incisions, then we can do the neck lift only, or we can do the neck and jowl lift, depending on what a person needs. One of the key elements of a platysmoplasty, there are many types of platysmoplasties, is to recreate a tight sort of hammock, a sling that goes almost from ear to ear. We want that muscle, that platysma muscle, to restore the cervical mental angle. That's the bend, or that's the angle underneath the chin that reflects a youthful, very beautiful neck and jaw and chin line. So oftentimes the fat seems to accumulate in that area, the muscle gets lax, the skin can get lax, there can be too much skin, and we need to address each of those components. There's also something called subplatysmal remodeling or subplatysmoplasty. That should be done very gingerly because under the platysma muscle, let me back up for a moment. The platysma muscle is a very broad fan-shaped muscle that comes from the lower part of the jaw, the mandible, down to about the clavicles. And in our species, it's vestigial. It's very much like the appendix. It has lost its function. The only remaining function that I know of, it just gives plastic surgeons work. So we're grateful for that. But if we compare that to, say, the horse, the horse has that huge jaw, that very long mandible. The platysma muscle in the horse runs about 3/4 of the way down the body, and it's the shivering muscle. That's how the horse shivers and shakes off the flies. So in our species, as I said, it has no function except to reinforce the soft tissues, those deeper structures in the neck. There's something called the superficial cervical fascia that keeps the platysma muscle in place. With time, of course, that connective tissue gets lax, and the platysma muscle can droop. For early platysmal banding, when we have just a little bit of banding underneath the chin at that anterior part of the neck, Botox, botulinum toxin, can make those tight muscles relax and the muscles can fall back, restoring the cervical mental angle. I talked about the fat. I talked about the skin. Now, I do want to go back to that topic, as I said, subplatysmal remodeling or submental platysmoplasty. Underneath the platysma muscle, there's fat, and there are also glands. They help to make the spit. They're the lymph nodes and salivary glands, minor salivary glands, major salivary glands. There's some paired submaxillary glands underneath here of the corners on the sides of the Adam's apple, and they can show in some people whether or not they have a platysmoplasty. So what we need to do is keep in mind, even if we firm up the soft tissues of the neck to recreate that sling and deepen the cervical mental angle, sometimes those submandibular glands show, and that's a normal structure. Now, I talked about subplatysmal surgery. We can sculpt that fat, remove that fat in a conservative fashion. Some people advocate shaving down the submaxillary glands or even removing the submaxillary glands. That's an uncommon, rare procedure in my practice because I think that being able to make the saliva under the tongue is a desirable thing. We don't want to give people dry mouth. Some of that fullness is natural. I think if we take out too much fat, take out too much of that glandular tissue, if we take out too much of the salivary gland tissue, then it gives a kind of a cachectic, unnatural look. It makes that submental or cervical mental angle too sharp. And what we're trying to do is give a natural result, a natural looking, clean, crisp, firm neckline for a natural neck lift or a neck and jowl lift. On occasion, I will, in a conservative fashion, shave down those glands if they're quite large, but in general, I'm not an advocate of removing the glands. And of course, if we're going to do some subplatysmal surgery, the patient has to be aware that there are very important nerves, arteries and vessels, arteries and veins deep to the platysmal muscle, so we have to be aware of that. There is some risk to going into those planes. We do know our anatomy very well. On occasion, there can be a variation in the nerve. For example, the marginal mandibular nerve, that's the nerve that comes out from behind the ear under the platysmal muscle, and it innervates the muscles of the chin and corners of the mouth, and so sometimes people can get a crooked smile, etc. Sometimes they can show their lower teeth only in a different way compared to before surgery. Now, I do want my patients to know that temporary asymmetries, having a temporary crooked smile, temporarily being able to only make a sort of a different purse of the lips, I'd say that's very common. Sometimes the nerves get brushed aside, and sometimes they get angry or go to sleep for a few weeks. So I tell my patients for a few weeks, that's very common when we do platysmal surgery, or even just platysmal surgery or subplatysmal surgery. It's very common to have some asymmetries for that, but that typically resolves. Can be permanent, but it typically resolves. So, in summary, there are different ways to do neck and jowl lifting and elevation. In my practice, I believe that a clean, crisp, firm, well-defined chin and neck and jawline is a desirable feature for both women and men. I think it serves as the foundation for a beautiful face, for a handsome face. You can have a facelift along with the neck and jowl lift. You do not have to. You can have what you want. We need to look at your pictures together from today. We can look at your pictures from years ago. We can go over your vector computer images, and we can custom design an approach for you, hopefully helping you to achieve your goals, because you can have the approach that you want, and what is most important is not what I think you need or what I think you want, but actually is what you want. If you come into my office and you tell me that you want something that I disagree with, I will tell you. In certain circumstances, I'll suggest that you go somewhere else, but I think that communication that goes on during the consultation, during the first 1 or 2 visits, about what you want, what about the changes that you want to make, I think are very important for you to tell me, to transmit and convey, and for me to hear. If you'd like any more information about the natural neck lift or neck and jowl lift or facelifting, I hope you'll call my office here in Monterey, California, 831-646-8661, or go to my website, drmorwood.com. That's DRMORWOOD. We're going to take a very brief pause for a very good cause. We're coming right back. Hello, I'm Dr. David Morwood. I have over 25 years experience in plastic surgery. Here in California, we all love the outdoors. Golf, tennis, going to the beach. However, the sun can play havoc with the delicate skin on the back of the hands and neck. Call or click today to learn the newest methods for restoration and beautification of the hands, neck, and other areas affected by the sun.